Can you give us some tips for taking good care of the skin during winter and any special advice that you have for dry skin?
Sure. If you want to write this down, because this is a I say this to patients at least 15 times a day, and half of them don't remember it because they're not focused or writing. So if you want to write this down, this is a good way of avoiding rashes and eczema, especially in the winter. For most of you who are on cholesterol meds, you're going to get rashes. It's common. Cholesterol medication dries out your skin just like it's changing cholesterol in your blood. So you need to do a 5-minute or less shower, lukewarm water. You can time yourself. Many of us have bathrooms that have lights that go on automatically and turn off automatically. They usually time to a 5-minute cycle, 5 or 10 minutes. So 5 minutes or less in the shower. Soap only on the hairy areas, which is your scalp, your underarms, your private area, and your face. That's it. You don't want to soap yourself everywhere. You don't need it. You only need it in humid places to get all the stickiness off. In the U.S., there is no humidity. Right now, there's very little humidity, except in the summertime. So quick showers, very little soap, which is very difficult for most Indians to do. Most Indians are used to showering for 30 minutes and soaping constantly, meaning you don't need to be that clean. COVID virus doesn't enter your back skin because you're putting soap there. It enters through your nasal passages in your mouth. So cleaning your hands is all you need to do, and your scalp and your face and butt. So that's something you got to get out of. The other thing in the in the Indian mindset is most Indians grew up in India, and it's true even here among the young people. But many of them grew up in India, and I've noticed that the soap advertising in India is very kind of racist. It's biased toward lighter skin. So I think that, and I talked to a soap executive in India one time working for one of the soap companies, and he said, we purposely put ads up like that because the implication is the more I scrub my skin with soap, the lighter I'm going to get. Meaning the lighter the skin, the better it is, which is absolutely not true. In India, darker skin is probably better for protection, but that's kind of the mindset of certain populations, which has been ingrained into us by the British. So we got to get out of that. So that's kind of, I think, the reason why we do it. Plus, it's humid and sticky in India. So here it's not humid and it's not sticky. So don't do that. And then the last step is a good moisturizer. The best moisturizer is actually coconut oil. Coconut oil I recommend in the scalp and on the body as an anti-inflammatory. I have a whole list of natural things we can do, but coconut oil is at the top of my list, as is ashwagandha and 5 other things that I recommend. I'm coming out with a list of these soon, probably in the next 6 months. A few months, I'm coming up with a whole handout on natural skincare because there's a lot to benefit from it. Unfortunately, the literature is very weak, and you have to look at really critically what's out there. So a good moisturizer, shea butter, coconut oil, CeraVe cream, not lotion, and Cetaphil cream. Those are good. Anything creamy or a little bit oily works well. Okay?
Dr. Dhawan, that was a lot of useful information.